everybody. I just want to show you a couple of quick things that are a little bit different or some things that we've learned from the last time I did a tutorial. This one is specific to the S1 mental health simulation. So I'm going to start you again from the beginning of the screen, opening Zoom and starting a new meeting. So I like to start the new meeting with the students about 5 or 10 minutes before they're supposed to arrive to simulation. Because I think that it gives me, first of all, time to have everything set up. And then they don't get like this person's not available, which confuses them when that happens. So what I do is I'll mute and hide my video so I can work or I can talk to my family or whatever before they actually come in. And then I can see when they come in and pop up on my screen, and I'll unmute and start my video again. So remember that because I'm showing you both Zoom and doing the screen capture software, you're not going to see my Zoom running, but let's pretend that it is running in the background. So now I'm going to start the sim. I'm going to go to share screen. And one of the things that we learned is that you have to click this box every single time you do a simulation. You have to share the computer sound. That way the students can hear that embedded sound that's put into the simulation, the heart, the lungs, and anything else that we decide to share. So I'm going to go to the mental health sim and start sharing. So start the slideshow. And then this slide, I changed the how this works slide for the students. I changed it to the slide that I did when I did their tutorial before the S2. These students are not going to have the same tutorial, so they are not going to know how to annotate in Zoom. So this just has what it looks like on their screen and how to find it, so they can have a little bit of practice annotating before we get to the rest of the simulation. So then the simulation goes through Amanda Carey. She's got her sunglasses on. This is her S-bar, her background. I put the pertinent labs in there for her initial orders. Encourage the students to have paper and pen. They can jot down notes. That way all the pertinent things they need to keep track of, since they don't have a chart right in front of them. This is her room. We've added a name band to the room so they remember to walk into the room and identify the patient, and of course hand hygiene. Initial assessment, I added the patient pictures to the initial assessments because I think it's important that they remember what that patient looks like, and hopefully they'll pick up on those sunglasses and maybe check some pupils and things. So here are her assessment findings. Again, she has the heart and lung sounds. And as long as you've enabled that sound, they should be able to hear those. Okay, so nursing process, we've added the telephone, a choice to go out and go to the clean utility or kitchen or wherever they're going, or to start medicating. I've added the S-bar checklist. That's the same in the room. So they can pause here and do some annotation before they call the provider. Amanda, of course, will have additional orders of B12 to start with. And then once they're going through and gathering those supplies, then in administering that B12 is when she starts to show signs of alcohol withdrawal. So now she's progressing through alcohol withdrawal. Her vital signs change. They'll find that she's complaining of headache and the noise is bothering her, or skin crawling. They will hopefully call the provider again with an S-bar and then get orders for the CWA protocol. So the CWA protocol I've added as a PDF. So there are two ways that you can do this. The first way is to have to hit escape to get out of the slideshow, and then control click or double click and open. Now the students are not going to be able to see this because you're still sharing the slideshow. So you want to go to up here to say new share. So you're sharing the slideshow still. So you need to go over and hit CWA scale and share. So now the students are seeing the CWA scale. So now they can go through and start annotating. She's got some nausea, moderately anxious, etc., until they get their CWA scale. When you want to stop sharing that one, so remember, clear all the drawings, get out of annotation. Don't hit stop share, just go right to new share, and you can go back to the PowerPoint, and it takes you right back to that slide. You can go back into slideshow mode and keep progressing. So we'll go all the way the rest of the way through Amanda Carey, and then her final reassessment after she's had her Ativan, and then debrief. After you debrief, I've added an add pie, sort of a blank screen, so that you can type on there if you would like to add some things on there, or the students can add some things on there, just to make it a little bit easier to debrief how we normally would debrief after sim. Then we go to Eric Fram. Eric Fram has his folded sweatshirt. I'm not the best Photoshopper. My son has made fun of me already for this, but I think he looks pretty good. So here's Eric. Now same thing, going through his admitting orders, going to the room, initial assessments. Remember, he's talkative, he's happy, he's got this flight of ideas. It just keeps playing his heart and lung sounds. Okay, so they should be calling with their SBAR, and really there's nothing that the provider is going to do for them right now. He is supposed to have already been started on fluids. He's not. Sometimes they need that reminder. But he is supposed to be getting the violence risk assessment tool and the suicide screening tool done. So I've included those there. So the other way that you can share this is go to new share, and if you had already opened your PDFs ahead of time, if I go here, this is the screen with all the PDFs, and click this, up at the top I can see that I have the violence risk assessment in the suicide screen. So if I want to share that one first, then they'll see that, or the suicide risk screening, I can go to that. So they can mark these tools now. When they're finished with that, I go back to new share, go back to the PowerPoint, and it's still playing. I didn't even have to hit escape and then start the slideshow again, so we can move on. So that may be easier for you than trying to click into the PowerPoint just to have them open ahead of time. Okay, so we keep going through Eric. And so remember, as they're doing his meds, he is becoming, he's more and more talkative. So they're getting the vancomycin hung, starting the IV, and then Eric kind of crashes, right? He overdoses. So this is his overdose screen. They find that he's unresponsive, he's limp, very slow pulse, pupils are constricted. And what should they do now? They should not call. They should actually start the ambu bag, start resuscitation, and hopefully 15 liters with that ambu bag. What I have done here, because one of the things that we have found, remember, in real life, is that they kind of struggle with this, the use of the ambu bag and rescue breathing. So I found 4 pictures. And if you go through each one, and every time you click, it will tell them whether it's good or bad. So we say the first one is is he holding this well? Is this a good seal? The answer is no. Is this one a good seal? No. Is this one a good hold? Not really. And then is this a good one? Yes, this is the good seal. This is what it should look like when you're holding an ambu bag. Now they can call, someone can call with their SBAR, which is where they'll get the Narcan order. So the Narcan order that we have built into Care Connect and into the sim is for 2 milligrams IV push. So when they go back to their Pyxis, they'll find that there's 2 different Narcans. And I did this on purpose because typically your typical dose is your 0.4 milligrams per ml, and you would give 1 ml. We have it written for 2, and that is the maximum range. So one of the things that happens to Eric is, in the scenario, is that he immediately goes into withdrawal. And when I did some more reading, what I learned was that for patients who have chronic opiate use, like Eric Fram, when you do that maximum dose of Narcan, you're at a higher risk of putting them into an immediate withdrawal versus doing the lower end, where you're going to kind of just bring them back without putting them into such severe withdrawal symptoms. So we kept it as is. It's something that you could maybe discuss in debriefing about the range and being comfortable with the medication and knowing what the normal dose is. But that is up to you. All right, so the med station, they'll give him the Narcan, and then of course he starts to come back. He's restless, agitated, because again, we put him into severe withdrawal. So this is where now they would do the opiate withdrawal scale, the COWS scale. So again, go to new share, find those PDFs, here they are. And here it is, right here is the COWS scale. Then I can go back to the slideshow and debrief with add pie. And then it would be time to complete the post work. So the post work I included is the case study. So the students will read through the case study and then go to the first question. So the question will appear when they come up with an answer. You click again and the answer appears. So the next question appears, click again, here's the answer, etc., all the way through to the end, which I think this is the last question here. And then that takes you to the end of the PowerPoint and the end of the simulation. So this one's a little bit different with the PDFs. Let me know how that works. It was just hard to embed them in a manner that was easy to read on the PowerPoint. So let me know how that works. I'll start sending everybody all of the information that goes with this. The timing thing that has the the sort of background information with the sim, the debriefing tool that we take notes on, and of course the PowerPoints I'll send to you guys. So let me know if you have any questions, and I think this one should also go pretty well. We'll talk to you guys soon.